PHIMC launched SHAC in 2016 in partnership with Healthy Schools campaign. Our vision is to support increased and equitable access to school health services for Chicago young people. The collaborative aims to strengthen the school health system to provide comprehensive, coordinated, and sustainable care for Chicago public school students. CPS currently serves over 340,000 students across over 600 schools. Many of these students receive the majority of their needed health services at school, which is why it is so important to have a strong school health system to support them. SHAC brings together a broad range of school health stakeholders to share best practices, leverage collaborative opportunities for systems level change, and tackle barriers to health for Chicago's young people. SHAC priorities include leveraging data sharing to connect young people to services, expanding Medicaid coverage and reimbursement for school health services, and promoting the value of school health to the broader community. I would now like to introduce a couple of our SHAC partners, Kristen Nuyen, Capacity Building Director for EverThrive Illinois, and Rebecca Langan, Director of External Affairs for Youth Guidance, to share their thoughts on what a healthy school environment looks like, health equity, and why the School Health Access Collaborative is so important.
To me, health equity is a lot of things. Health equity really is an opportunity for every young person, every individual, every family to have consistent access to services that meet them where they are. This means that the services are high quality, they're available, and they are delivered by individuals that represent the lived experiences that are paramount to the families, individuals, and young people seeking help. Our country has demonstrated an extremely high tolerance for health inequity and health disparity. We now have extraordinary numbers of individuals that have endured years of disparity. They have endured years of racialized trauma, and they have continued to suffer intergenerational violence. We now have entire communities who lack access to safety, education, employment, resources, and these are all social determinants of health. So when we think about health equity, to me, it really means that we have to rally as many unapologetic disruptors as we can find to dismantle the systems of oppression that intentionally promote health inequities.
It means directing resources to places that have traditionally, either lacked resources or been restricted from accessing resources, and really focusing on areas of highest need, and to make sure that nobody's left behind and that everyone, is given priority when their community is the place that needs it most. I think it means like monetarily investments in the system. I think up until COVID, honestly, there hasn't been a huge investment in school health. And I think it's a great opportunity right now to think about not only like monetary support, but also how various players in different systems can work better to support health for students. And, I think, and like I was saying, I just think like Black and Brown communities, it's just been highlighted through the pandemic how historically the healthcare system has like marginalized those populations. And so I really think like working to make sure that particularly Black and Brown communities in Chicago are the ones that we're giving the most attention to right now, because they're the ones that need the most attention.
A healthy school environment really is one that is free from implicit bias, period. It's a place where each and every student is accepted, understood, and celebrated. Caregivers and families are valued as complete members of the learning team, and they are welcomed for everything that they bring to the table. A healthy school environment really provides a sense of physical safety, a sense of emotional safety, where educators and staff lead from a healing-centered framework. And it really truly is nearly impossible to understand or convey a description of a healthy school environment without naming the ways in which our education system in this country continues to be plagued by deep structural racism. In 2021, it is mission critical for us to continue to challenge this historical context. An imperative to understanding a healthy school environment, we really truly have to educate ourselves on the timeline of the education paradigm starting from 1619 all the way until 1965. And still today, we continue to remain plagued by vestiges that inform the way we think and fund education. Ultimately, healthy schools are well-funded schools. Well-funded schools have access to all kinds of discretionary behavioral supports, all kinds of discretionary health supports, enrichment programs, staff supports, after-school opportunities, extracurricular opportunities. And no matter the zip code, the funding levels and the funding formulas really need to match the proximate needs of the community in which they serve. And until we get to that place, a healthy school environment is going to continue to be something we have to fight for.
I would say a healthy school environment is a place where all young people feel, safe, supported, where they can thrive both academically, physically, and socially and emotionally. I think particularly even before the pandemic, one of the things we really were thinking about as a coalition in our work is how to support the behavioral health needs of young people. And I feel like this past year and a half has only highlighted how important, how equally important, if not maybe even more important, right? Physical health needs is the behavioral health needs of young people. And so definitely envision a place where like holistically young people are able to be their best selves.
A few things that really stand out for youth guidance on the data transformation project is the epic opportunity for providers like youth guidance to come together and think more concretely around the ways that we are lifting up young people and supporting not only their social emotional learning, their behavioral health, their mental health, but their paths to academic success. I mean, this year, youth guidance is both humbled and incredibly grateful to be a partner. We serve nearly 13,000 young people and families across 150 Chicago public schools. And we serve several other districts across several states in our country. And without the opportunity to connect the work that we do to the work that our partners are doing to support the whole constellation of student well-being, our work is done in silos. This project yields a chance to match the intent of our programming to the outcome so that with stronger policies, more effective policies, we can mandate funding levels match the need. And until we can do that collectively, we're operating from a place of not only fear, but a place of silo. The data transformation project really offers us a chance with a sense of urgency to address the need to build better together. We are really working hard to reweave the safety net in which students learn and succeed in schools. And the project gives us a path forward in order to do that. And on a very practical level, it gives us an opportunity to advance effective policies. And without effective policies which name the context in which we're operating, those funding levels will not have a chance to increase. This project is our circle of influence. And if we can advance change in our circle of influence, we're doing all that we can do to continue to fight for health equity. We know that education is one of the social determinants to ensuring equitable health outcomes. And until we level that playing field, we can't stop trying. And in the end, this is really all of us, any of us can do, is continue to keep trying to level the playing field, ensure as many young people have as much access as possible to equitable resources, regardless of the zip code from which they live. Thank you so much for your time.